Dr. Maria Foraster, good morning.
Good morning.
You have been selected by the AXA Research Fund for your project on pre- and postnatal maternal mental health and newborn neurodevelopment during the COVID-19 pandemic. Can you please share with us the main goals of this innovative research?
Well, we do know how a pandemic situation, which leads to fears, to confinement as we have lived, and to other personal situations can affect mental health, and particularly the mental health of vulnerable populations such as pregnant women or women that had a recent delivery and their children. So in order to understand this and in order to manage the situation of a pandemic better for these vulnerable populations, we have three objectives. The first objective is to assess the level of stress of the pregnant women and women that had a recent delivery before, during, and after the confinement in Barcelona, Spain. So here we are checking the confinement that we suffered in spring and early summer. It was very long. And second, the second objective is to identify which are the factors that are associated with this level of stress in mothers, or even to post-traumatic stress syndrome or depression during the pandemic. And third, we have also the aim to evaluate how this burden of mental health in mothers, how it can associate, so whether it is associated or not with the neurodevelopment of their child. And so these are our objectives.
Thank you. That's very, very interesting, and it's going to be very useful and helpful because indeed the COVID-19 pandemic must have been very stressful this year for pregnant women and for young mothers. So to go further a little bit with your first goal, can you tell us about the way you proceed to assess stress variation, please?
So one of the main strengths of our research is that we have the opportunity to assess stress repeatedly. So we have assessed stress before the pandemic started, and that's unusual. So we had previous information to the start of the pandemic. And then we have been assessing stress multiple times during the confinement and afterwards after confinement. So this gives us the opportunity to check the progression of stress in the mothers and also to look at the changes between the different phases of the pandemic. And how do we assess stress? So actually we use validated questionnaire tools to assess stress, and our participants can answer these questions themselves, and they can do it with an online questionnaire. So this is very useful because it gives us validated data, so it gives us useful information and detailed in time repeatedly in order to check stress, how it progresses, and at the same time participants have the flexibility to answer this questionnaire online, for example, through their mobile phones, and we then preserve the social distancing.
Okay, thanks. That's very clear. So you will learn a lot of information about how these women have felt and still feel. And once you have analyzed all this information, because you'll gather lots of data, I had a question about how much of findings will be shared and used to help pregnant women and young mothers mitigate the burden of stress and anxiety on the one hand, and also to improve the neurodevelopment of newborns on the other hand, and in which time frame?
Yeah, well, our findings will help us understand how a pandemic situation affects maternal mental health and stress, and also how it may affect the newborns, right? So, but we will also check, and it will also help us understand which are the factors that lead to this situation. So then we can consider these factors, these situations, and the mothers that have these situations in order to build evidence-based tools. So tools that are based on this scientific information and that help us in the management plan. So we can integrate this information in the management plans of the current crisis and future epidemics. So, for example, let's imagine that we find out, so this is a hypothesis, we don't have the results yet. Let's imagine that women that are teleworking and that also have to take care of the child and that do not have social support because of the pandemic situation, compared to mothers that do not have this situation, they have greater stress and they are at greater risk of mental health. So with this tool, we could identify this situation as a risky situation, and then the administration or companies and the health professionals could give support to the mothers in this situation in order to avoid this mental health burden that we could avoid during this pandemic and that currently we don't know if we need to consider. So this is the type of information that we can use to mitigate the burden. And then regarding the time frame, we expect to have and disseminate the first results on maternal stress in less than 1 year.
Excellent. Well, thank you very much for your time and for sharing this information today. And all the best for your project. And we'll be back in touch soon to discover your first outcomes then. Thanks a lot.
Thank you very much.
Bye-bye.
Bye-bye.